Hey guys, it's me again. Just want to come and do the part two of my interview um video questions video on my interview questions. There you go. So I have here listed on my phone the questions that I remember and how I answered them. They might not be exactly what I said, but it's still in the same area of what I said. So the number one question that they asked me, the first one when I sat down, was tell me about yourself, or tell me a little bit about yourself. So basically, what I said, sorry if I say so basically, but I started off with telling them that I was born and raised here in this hometown, and that, yeah, like I said, I was born and raised in Corpus, right? Um, I told them that I wanted to be a nurse or a teacher or a social worker, either one of those I wanted to be. But after my first job of working with a pediatric patient as a pediatric home health provider, I realized that I love pediatrics, I love kids, I love babies, that I really wanted to be a nurse. And as a nurse, I can be all of those things: a teacher, a social worker, and a patient caregiver. So that was my past, right? I told them my past, and then I told them presently I just graduated in August from my university with a bachelor's of science in nursing, and I really enjoy this hospital because of their mission because of their values, and I could really see myself working for this hospital. And then I told them that I really love their hospital. I've passed by it so many times, and it's one of the number one rated hospitals to work for, one of the best hospitals to work for. I really emphasized that I really enjoyed that, and that's basically what I told them about myself, and that I'm just eager to work and eager to be part of their staff. That's how I answered that question. That question is kind of hard to answer because you don't want to give details that aren't, oh, I like to watch movies, I like to do this. Like, no. Stick to the past if it pertains to the job, and then present, and then future. That's how I did it. The next question was describe a time you had to make a difficult decision. Sorry, I hate that word. The difficult choice this past year. So in my brain, I was like, oh my god, what am I going to talk about? What am I going to talk about? How am I going to relate to this job? So basically, I told them about an experience that I had in my last semester of nursing school during clinicals, where I had to tell them about a patient who I assessed, who was post-op, and who just didn't look right to me. She was post-op a few hours. Her vital signs were a little funny, and I didn't feel right. So I went to get another nurse, and together we checked the patient, and she was bleeding heavily. So we had to give her the medication to make her uterus contract to stop her bleeding. So that was really good example that I used. So if there's any situation that she had to make a choice as a nurse, I would highly suggest that, because it lets you know that you assess and that you did something about it. You did not let the patient just stay there and bleed and die. So anything work related, school related, nursing related works for that question. My next question was, how do you handle work conflict? So basically, since I hadn't worked as a healthcare provider in over, should see, maybe like 4 years, I hadn't been a healthcare provider. My previous job was as an employee at Macy's. And I told them, okay, well, my last job was as a part-time flex worker at Macy's, and yes, there was conflict at Macy's. I basically told them, as a flex worker, I was put in all the departments, and sometimes those departments did not want me there because I would take, I guess, their commission cells. So I told them we worked together, we talked about the situation before calling the manager. Just emphasizing that you know how to work it out and you don't automatically go and ask for whoever's higher than you. We try to work it out, we work together, we compromise. Using all those words really shows that you are a team player. and say that I am a team player and we try to figure things out ourselves. If the problem is not resolved and I can't do anything else about it, then I would to go get my supervisor, manager, etc., etc. um, the next question was, why are you interested in this position in this hospital? So basically, at this time is when before you even go into their interview, you want to research their mission statement and their values, anything special about the hospital. This hospital really focuses on caring and patient customer service. So I told them, I looked up your hospital and I really um, enjoyed your hospital's mission statement and how they focused on patient care. And I am all about giving the best patient care to the families and the patient, because it's not just the patient, it's the family. It's holistic care that I want to focus on. And this hospital really goes with what I believe is important in giving patient care. Basically, something like that. Just if you want to give name their mission statement and value, that's even better because you have it memorized. That's another one. Another question that I was not expecting to be asked was, what are your long and short term goals? I was like, what? I didn't want to say like, oh yeah, I plan to leave this job in a year and go work for somewhere else. That is not going to get you a job, ladies and gentlemen. I told them my short term goals for this year were to mature as a nurse and learn as much as I could. I told them maybe later on my long-term goal was to go back to school to get my master's degree, but that's not anytime soon. I told them I don't plan to move from this city anytime soon. And that's basically all I said because that was my short and long-term goals, right? Short-term goal is to mature as a nurse. Long-term goal is to get a master's degree. So, I like that answer. Another question that I was like, what are your major accomplishments this past year? And she told me other than graduating from nursing school, but I did tell them that was an important accomplishment for me because I was the first in my family to graduate, first in my family to go to college and to graduate with a bachelor's degree. Um, I told them but my biggest accomplishment this year was just how I saw myself as a fifth semester nursing student. Looking at how I was as a nurse and fundamentals and see how far I've come as a graduate nurse, I can see how much I've grown as a nurse, and it's just amazing of how much you absorb and learn in 5 semesters. But I did tell them that I know I have so much to learn, and that's why this program is awesome. Another common interview question that I got was, what is your greatest weakness? And I told them a couple. I chose two. I said, of course, my first weakness is that I am a graduate nurse, no experience. But then again, I think that's a good thing because you come in as a graduate nurse so ready to work, so optimistic, you're hardworking, and you're just so positive in any situation. And I told them that this program will help build my foundation as a NICU nurse, and I can just get better. I can only grow. I told them another weakness I have is delegation because as a student nurse, we didn't really get to do a lot of delegation. So this is another weakness, but that also comes with experience. So those are two things that I said. I said it was a weakness, but I turned it into a positive. That's what you want to do in those questions. Another question was, how would your coworkers, professors describe you? And this is a question that you're like, bam, 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 bam. You want to say a lot of positive answers. This is where you say, my coworkers and professors will say, I'm a team player. I am caring, I am compassionate, I am hardworking. You want to say all those good things about yourself, right? You want to make yourself look really good. Just say team player, compassionate, caring, hardworking. Like I said, um, you're honest, you're loyal, you're punctual. Any good thing that your professors or your coworkers say about you, you want to say. And if you want to give examples, you can give examples as well. Another question was, this is kind of my last question I had, was why are you the best candidate for this position? And this is a question that was kind of the most difficult because I didn't want to say I'm better than everyone else who applied, but I didn't really know who applied because they took so many applicants. So I told them was, I can only tell you about me because I know myself personally and I don't know who else has graduated or who else has applied for this position. So I can't tell you, yes, I'm better than her or him because I don't know who they are. But looking at myself and looking how I work as a nurse, student nurse, I can tell you that hiring me and training me, you will get a hardworking, compassionate nurse who cares about their patients and their families. And that's basically how I left it off. Which I think was a great answer. And then the last questions were, do you have any questions for us? And you shouldn't say no, we don't have any questions. I just asked them about the program and how long it was and basic questions like that. Oh, I also asked them what is the best candidate for this position? Like what qualities do they have? So basically, and then the answer she gave me was basically everything you said. Hardworking, team player, loyal, and I was like, yeah. So that was good. They also asked me if I was interested in any certain area, and I said no. I'm really flexible. I can work wherever. I just really want to work. And then they asked me if I was preferred day or night shift. That's where I said no. I'll do days or nights. I don't have any. I'm not like picky. So that is basically all the questions that they asked me that I can remember. And I got asked the same questions in both interviews. So that was really good. That was a lot. And I am just so thankful to for everything that has happened after graduation. Getting a job was a little bit harder than I thought, but also having to take NCLEX twice really really it was difficult, but I mean I took NCLEX again, I passed it, I'm days away from starting my job. I am just so blessed right now. And if you are still preparing for the NCLEX, don't give up. Keep trying. I was like, after I failed NCLEX the first time, I was like, do I want to do this again? I'm so broke. I'm like negative broke. It's not cheap, but you have come so far. You finished nursing school, and there's so many people I know, so many students, people who are in nursing school, who just give kudos to people who finish nursing school and are nurses because it is difficult. It's not the easiest job, but it's just remember when you were in clinicals and how you had that family, that patient who just thank you for caring for them and not just treating them as another patient, but actually took time and talked to them and just made a difference while you were there for those 8, 10, 12 hours. That's basically how I kept myself moving forward is the impact and how I really love caring for people. Just your compassion, your passion for this job. Because I really can't think of doing anything else for the rest of my life. Like thinking about going to work every day and caring for these precious babies, like what better job can you ask for, you know? So I start working on Monday. It is Friday. I'm gonna go right now to buy my scrubs and get some shoes and get a cute badge. Maybe the ones on Etsy, order one. I'm thinking about getting a new stethoscope, a Littmann. I don't have a Littmann. I want the Infant Littmann. I'm so excited, guys. Um, that's all for today. This video is already 16 minutes long, almost 16. So I will talk to you later. Have a great New Year, guys. Bye.